There are tens of thousands of veterans living in Indiana, Kentucky, and Ohio who the VA wants to find as part of an effort to give them the health care they've earned.
You need to come in and get taken care of.
I'm speaking with Ellen Graff, the chief of patient business services at the Cincinnati VA Medical Center. She says they've seen a record number of veterans enrolling for care at the Cincinnati VA, and they've doubled their enrollment staff to meet the demand.
What we're doing now is we're collaborating really closely with primary care. So when you come in and you're enrolled, you will leave with your first primary care appointment. And you will also leave with a toxic exposure screening.
As she explains, the toxic screening is a short 5 to 10 minute interview about deployment locations and potential exposures to toxic environments.
We're going to be looking at you going, oh, you were in this area under these conditions, and we are going to presume that the medical condition that you're linking to is because of that. And because of that, we are going to be providing you your medical treatment.
As it stands, the U.S. Department of Veterans Affairs estimates more than 58,000 veterans between Kentucky, Indiana, and Ohio are not enrolled in health care with the VA. These veterans range in service from the Vietnam and the Gulf War to the most recent wars in Iraq and Afghanistan. And it's important to point out that the enrollment in toxic screenings is separate from any disability claim with a percentage rating.
Can you still come and enroll in the VA without having one of those percentages from 0 to 100?
You can enroll, yes, and you should.
And because of that enrollment, that could possibly trigger the system to say, oh, hey, this new designation now covers you. Come on in for additional care.
Yes.
In some instances, veterans who served in Vietnam, the Gulf War, Iraq, and Afghanistan, along with other locations, do not need to have any health conditions specifically associated with their service in order to be eligible for care, according to the VA.
Even though if you're not coming here for your primary care, you should be in the system. Why is that important?
I think that's important because we're continuously doing research about any type of medical conditions. I mean, the PACT Act right now is really important because we're talking about environmental exposures and toxic exposures while you are serving.
Right.
And from that research, we have come up with presumptive conditions. We've come up with the need to reach out to our veterans who have these conditions to say, you need to come in and get taken care of, and we will take care of that free of charge.
The enrollment process, fairly simple here with no appointment necessary. More details on that and the outreach program they have in this online story, WCPO.com/homefront.